as you all know, medicine has had exponential growth over the past decades, really. We can now have new technologies operate from remotely even. We can have new technologies for diagnosis, new medications, change genetic diseases that were otherwise untreatable. So we have come a very long way. What has also changed, apart from technology and pharmaceuticals, is our outlook on medicine and how we feel about the patients and how we treat the patients. Respect for the patient is now at the core of everything we do, and the patients are there in every discussion we do about the future of health. And this is important because patients, at the end of the day, are the people who need what we provide for them. So they have to be at the core of every discussion. Now, I think the pandemic has shown us a couple of things that we were not aware of, that despite all our progress, there are things that can turn things upside down, as the pandemic did. Because in medicine, we normally work with guidelines, and guidelines come after a number of studies, long-term examination of the results of medications, of policies, and we had none of these. So this was a new virus we knew nothing about. We had to deal and we had to treat the patients somehow, not knowing a thing about what was happening. So what they showed us is that we need to have the education and make educated guesses and go from there. But it also showed us that collaboration and the technology we have currently led to very quick solutions that were actually the solutions we needed. So we've managed to identify the virus pretty quickly. We managed to have vaccines very quickly, and out of a global effort and good technology, but also ample studies based on the huge number of patients we had. So it showed us that we can do things much more easily than we could in the past, and in a good way. But it also showed us that we have to have systems that are very versatile. And I'll give you an example. 2 months ago, I think, we had a meeting at the Stavros Niarchos Foundation, and there was an architect there who told us that he was asked to redo a building that used to be an automobile factory in France and turn it into a hospital. And on top of whatever he had to do, they asked him to make a huge underground parking, which actually was a lot of cost. And he didn't think it was worth it. And then he went to a visit to Israel, where he realized that the basement of the hospital could be turned into an ICU facility and had oxygen and everything they needed. So he said, yes, we can do that. We can build this underground parking lot, but this will have the facility to become an emergency center if needed. And these are things that we can do now, and how we can plan our future hospitals so that they can be really versatile and accommodate emergency situations, chronic situations, and be able to function according to what we need to deal with. And this also has to do with medical education and healthcare worker education, because also in medicine, for example, we had in Greek hospitals, for example, in the north of Greece, we had internal medicine departments that normally have 30 patients, and now during the pandemic, they had to deal with 100 patients or 140 patients. So doctors had to come and work, even doctors who were not trained in internal medicine, but who were trained in orthopedics or in ophthalmology, and help there. And this tells us that the education has to be an education of cooperation and an education where we need to be able to adapt and treat whatever we need to do. And the same goes for, of course, nurses, the same goes for every personnel, but not just healthcare personnel, but also, if you want, every citizen. Probably all of us need to be trained to deal with emergency situations, help a person who's injured at a road accident. So really, we need to have this culture of collaboration and respect for the patient. An important thing, and this is the Economist forum, is finances. And as you can see and understand, financing healthcare is becoming more and more expensive. So there are sometimes choices we have to make. We all have to deal with what is cost effective, the risk-benefit ratio, and also resources are finite. There's no way we can have 10 times the resources we have now or 100 times the resources we have now in one particular aspect of our daily life. For example, health or education. So we need to deal with whatever we have so that every person currently living on the earth and those generations who will come after us will be able to have health, will be able to have education. So we need to treat our resources and our expenditures correctly. And this is where we need to come and sit and discuss, all of us. And I mean all of us, insurance companies, politicians, patients, of course, doctors, nurses, everybody who's involved, technology companies, pharmaceutical companies, discuss the way forward. And I think this is also very important. So what we have done in Greece, just to give you a rough idea of what we have done so far, we introduced what we call personal doctor, which is an equivalent to the GP. And it's working with, of course, minor setbacks because everything that is new has to be adapted by everyone in the society. And we're also changing things in secondary care because we think that secondary care is something that affects us all. There has to be a link between primary care and secondary care. There has to be an easy pathway for every patient to get what he or she needs. There also has to be a very important path in prevention, and prevention comes with education and with everything that is healthy, that is a healthy lifestyle. And this starts from home and this starts from school. So things like non-smoking, which is probably the most cost-effective measure for most things in cardiovascular medicine, in pulmonary medicine, and in cancer, is a very important measure which we all have to work for. Alcohol consumption, exercise, these are other important things that we all need to take care of and sort of be ambassadors for, because they can help us sustain medical systems and healthcare worldwide, because there will be less people who are sick. And also prenatal care and testing for genetic diseases is also very important, because not only it helps deal with a disease, but it also takes away all the pain for the whole family, all the problems for the children, and the cost that is linked to all those diseases. So I think I will finish somewhere here, and I'm happy to answer questions, but I think our medicine at the moment, the things that we have to build the new healthcare systems, or actually adapt healthcare systems to, the basic things are, first of all, respect for the patient. The patient is at the core of what we do. The needs and the expectations of the patients are always there and have to be discussed and have to be considered when we treat the patient or when we propose anything. The proposals have to be within the medical safety and what is acceptable medically. But definitely the patient has to have a say, and it is about their lives that we're talking about. So respect for the patient is at the core of what we do. The next thing is collaboration and teamwork, because nothing in medicine anymore is a one-man show. It has to do with the help of the personal doctor, the help of the specialized doctor if needed, of the physiotherapist, of the psychologist, especially in case of life-threatening disease or chronic disease, pain relief, exercise, you name it, you have it. So it's collaborative work. And what is also fundamental is problem solving. We need to solve the patient's problems, we need to solve the medical problems, and we need to adapt our systems so that they can be agile and sustainable. Thank you very much.
Thank you.